In this lecture, we will discuss about the key issues across vulnerable groups in the times of COVID-19. The vulnerable population is the one that has more chances to exposure to COVID-19 and also mental health effects of it. They include first responders, which are doctors, nurses, other medical staff, police, older population, people with chronic physical ailments, people with pre-existing mental health issues, those quarantined alone with no social support, people with addiction problems, migrant and marginalized community workers, pregnant women, victims and survivors of abuse. Now, we will discuss about what are the factors contributing to this vulnerability. These new terms have come into our lives this year. They are social distancing, quarantine, and isolation. Social distancing is known as undertaking several measures to stop or reduce the spread of highly infective diseases, which include limiting large group of people coming together, closing down public buildings such as schools, universities, places of worship, and recreational activity areas, cancelling public events, etc. Quarantine is also known as the separation of persons who have come into contact with a contagious disease to ascertain whether they have become infected to ensure reducing the risk of them infecting others. Isolation is where a person diagnosed to have an infective disease is separated from others to avoid passing on the disease to healthy people. Due to increased physical and emotional isolation and discrimination, common issues are being faced by people, resulting excessive fatigue, fear, emotional and sleep disturbances. Now, we will look up to some latest researches on the vulnerable population in the times of COVID-19, which are: according to Wang et al. In the year 2020, family members and close acquaintances of those who are found COVID-19 positive face mental health issues due to procedural tracing, isolation, and quarantine, making persons more anxious and guilty regarding the aftermath of the pandemic and stigma imposed on their family members and friends. Another study by Goyal et al. In the year 2020 says that those family members who have lost their loved ones due to COVID-19 have shown higher anger and resentment. They have also reported of feeling emotions of shame, guilt, and stigma for those family members or loved ones who are sick or quarantined. Another study by Shah et al. In the year 2020 revealed that those children who were isolated or have propensity to develop acute stress disorder, adjustment disorder, and grief. Healthcare professionals have been in the foreground in the fight against COVID-19. They are facing an increased amount of workload with the fear of contacting COVID-19. Along with increased workload, physical and emotional isolation and discrimination causing fatigue, fear, emotional and sleep disturbances. Another study by Dong and Bu in 2020, it has been seen that distress for people with comorbid conditions and pre-existing mental illness due to the rapid spread of the pandemic concerns regarding substantial increase of fear, worry and concern among older adults and people with underlying comorbid disorders have been cropping up. It has been found that the symptoms of COVID-19 can also further deteriorate cognitive distress and anxiety among people who have pre-existing poor mental health. This is one population of people who have been severely affected by the pandemic. Those affected with ill health, comorbidity, and or existing mental health illnesses are at substantial risk of worsening their disease due to the psychological feelings of distress, fear, helplessness, loneliness, anxiety, disturbed sleeping patterns, and inability to make regular visits for evaluations because of the nationwide lockdowns. Patients suffering from chronic physical illness also requires regular follow-up and checkups in hospital and clinics, which become problematic and raise the chances of deterioration. Due to movement restrictions and isolation measures, patients with several mental illness are facing difficulties to receive treatment and may thus end up with relapse and emergency situations. Lack of regular social and recreational activities and staying at home for a longer time has had an impact on people's emotional well-being. Elderly population with underlying chronic health issues such as diabetes, heart disease, asthma are more prone than others, which is resulting into mental ill effects. This time can be particularly strange and upsetting for pregnant women as well. Pregnancy can be an exciting period, but also one of uncertainty in general. Currently, this phase may cause anxiety and stress in new mothers and family members. Pregnant women and their caregivers are highly influenced by the emotional responses brought on by the pandemic and may be excessively worried as regular checkups may become more risky and stressful home environment created due to the effects of the pandemic may have a negative impact on the pregnant women. In this lecture, we have summarized which population is at more risk during the pandemic, what one can understand by quarantine, social distancing, and isolation, and their influence in increasing vulnerability, and what the latest researchers have said about the pandemic and its effect. In this lecture, we will discuss about the key issues across